Dr. Muideen Bakare. I'm going to be talking about picture of autism spectrum disorder research in West Africa. So, approximately 1 in 100 children suffer from autism spectrum disorder globally. Diagnosis is based on criteria specified in Diagnostic and Statistical Manual of Mental Disorder, 5th edition, that is DSM-5, and also International Classification of Diseases, that is documented by WHO, 11th edition, ICD-11. Currently, there is no one standard treatment for ASD. That is to say, individual treatments is what is advocated for. So treatments are individualized based on the as need assessment of individual child suffering from autism spectrum disorder. There is a paper written in 1984 by Sauna where he raised an open question about whether infantile autism is a universal phenomenon. He wrote the paper in the International Journal of Social Psychiatry, 1984. He raised the issue about that ASD may likely be a disorder of children living in Western industrialized countries with high technological development. Thus, it may be uncommon among African children. That was his postulate as of 1984. The thought was that autism spectrum disorder may not be common among Africans. So, but about 4 decades after, in 2022, evidence are emerging that ASD, autism spectrum disorder, does occur among African children, including West Africans. This is a picture of cooking games, an example of social communication interaction among children in rural West African communities. Historical evidence and prevalence of ASD among African children living in Africa. Based on documented research publication, we will describe volume and scope of existing research evidence on ASD across the countries in West Africa sub-region. We identify area of gap in research and capacity development. Research evidence is required to guide health policy and capacity development on specific health conditions like autism spectrum disorder, which has been a neglected condition in sub-Saharan Africa. So what is the prevalence of ASD among West African children in Africa? Clinic-based population suggests that the prevalence ranges from 0.8 to 2.3%, based on research that has been carried out in West African sub-region by Bakare et al., Lagunjo et al., Bakare et al. In 2019. So, prevalence of ASD among children with intellectual disability or with other form of neurodevelopmental problem in Nigeria ranges between 11.4% and 34.5%, based on various research publications that have been documented. Prevalence of ASD among children in normal mainstream school, based on population. Normal mainstream school-based population is reported to be about 2.9%. So there are a limited number of studies that have examined the population-based study, the general community population-based study about autism spectrum disorder in West Africa. So this area needs to still be explored, whereby we can look at various community-based population study to get accurate figures about the prevalence of autism spectrum disorder within the community. Prevalence of ASD among West African children outside Africa. A number of studies that have been done outside African sub-regions suggest that there is higher prevalence of autism spectrum disorders among Black Africans. For example, a study that was done in Sweden, so Gibbal et al. 1995, so that as much as almost 200% of higher population of children of Black Africa have autism spectrum disorder when compared to the indigenous population. The reason for this is not yet clear, but it may be related to vitamin D, etiological hypothesis of autism spectrum disorder that has been documented in past research. So the paper I'm going to be focusing on is the paper that looked at picture of autism spectrum disorder in West Africa. It's a scoping review that was published in Research in Autism Spectrum Disorder. This is the citation of the article. The focus of the study tried to describe the volume and scope of existing research evidence on ASD across countries in the West African sub-region, tried to identify area of gap in research and capacity development, The reason we have to engage in doing this paper is because research evidence is required to guide health policy and capacity development on specific health conditions, such as autism spectrum disorder, which has been a neglected condition in sub-Saharan Africa. So this is West Africa, a map of West Africa. West Africa is the westernmost region of Africa, comprises of 16 countries of Benin Republic, Burkina Faso, Cape Verde, Gambia, Ghana, Guinea-Bissau, Ivory Coast, Liberia, Mali, Mauritania, Niger, Nigeria, Senegal, Sierra Leone, and Togo, as well as the highlands. The population of West Africa is estimated at about 381 million people as at 2018. So why study ASD in West Africa? Period of onset of ASD symptoms among West African children coincide with the age of less than 5 years, which is characterized by vulnerability of African children to physical illnesses and infectious diseases associated with neurological complications such as cerebral malaria, meningitis, among others. The severity, what it means is that it's during this period of under 5 years that most children usually have symptoms of autism spectrum disorder surfacing, and it coincides with period where there is infectious diseases such as cerebral malaria, such as meningitis in children under the age of 5 years. So we're not sure the specific association of those infectious diseases that have neurological complications with the emergence of ASD symptoms among West African children. So the severity, comorbidity, and other factors associated with autism spectrum disorder vary greatly in West Africa compared to what is seen globally. So that's the need for us to explore what is the characteristics looking like among West African children when they compare to global pictures among other children in the western part of the world. So, for example, average age of diagnosis in West Africa is usually about schooling age at the age of 6 years. So, what method did we employ in doing this review and this study? We did literature search of original research articles on ASD in each of the 16 West African countries in PubMed, Google Scholar, Google Search, Africa Index Medicus, and a direct search of references, list of pertinent journal articles. Publications that we examined included peer-reviewed origin articles, irrespective of their impact factors, carried out within the West African sub-regions, and the papers are available in English or translated to English. Methodological framework described by Haskell and O'Malley, 2005, was used to synthesize and present results. So the design of our study included, we synthesized about 41 articles that meet criteria for publication. So this table shows those papers that we excluded and those papers that were included. So at the end of the day, we are able to find 41 papers that meet the inclusion criteria after eliminating those papers that are not relevant to publication. So a total of 41 studies that met the inclusion criteria across 5 countries in the sub-region were identified. 5 thematic areas emerged from the literature, namely prevalence and risk factors, professional knowledge and attitude towards people with ASD and their family and social aspects of ASD, screening, diagnosis of ASD in the sub-region, intervention and treatment. It's important to know that only 5 out of the 16 countries in the sub-region had at least one study, with the bulk of the research coming from Nigeria. So this table shows distribution of research articles on ASD in West Africa based on the 5 thematic areas I earlier identified. So the prevalence and associated factor has the highest number of articles. Professional knowledge is followed by professional knowledge and attitude. Family and social aspects is the next one, and the screening and diagnosis while there is limited paper on intervention and treatment. So major limitations and challenges. So research articles on the prevalence and associated factor and professional knowledge of ASD appear modest in the sub-region. We notice that a huge gap still exists in the area of epidemiology. Like I mentioned, community epidemiology of ASD in West Africa, etiology, diagnosis, and treatment and intervention studies. Those areas of studies are limited. So this graph reflects volume of research per country and per population of the country in West Africa. So the highest number of papers are coming from Nigeria, followed by Ghana. So we identify future direction based on identified gaps. The future direction that we identify include defining the magnitude or burden of autism spectrum disorder in West Africa through well-implemented community-based epidemiological studies, engaging in longitudinal follow-up studies to understand prognosis of ASD across lifespan in the sub-region. That is important. This will enable us to be able to describe the phenotype of ASD among adults, a particular form of research that is presently lacking in the sub-region. So we also need to probe into genetic and environmental risk factor for ASD in the sub-region and find what is the interaction between environment and genetic risk factor in the sub-region. We need to develop protocol for education of the populace to enhance early recognition of symptoms of autism, and this will help with prompt intervention and reduce stigma by promoting community inclusion. So future directions still include developing or adapting existing instruments for screening, diagnosis, and prognostic assessment in the sub-region, engaging in inter-country research collaboration and regional conferences on the subject of autism. In addition, research and social policy direction should focus on massive public health education to modify the poor help-seeking behavior of children and parents who have children with autism spectrum disorder and intellectual disability in the sub-region. This often leads to late diagnosis and delay in intervention. We conclude that modest research efforts have been made in West African sub-region, especially in the area of professional knowledge, awareness, attitude. However, the gaps in scientific evidence with regards to autism spectrum disorder is still enormous. An important drawback of the available studies is the weakness of the evidence they present due to methodological issues. There is need to address identified gaps. Address identified gaps that we were able to elicit from the literature. What next for ASD in West Africa? We need to expand research to cover areas not yet explored in the West African sub-region. Longitudinal follow-up studies to understand prognosis of ASD across the child lifespan is essential. Describing the phenotype of ASD among adults using rigorous methodology is an area that should be explored. Thank you very much for